Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampatella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma. We have people that do not have access to people that will explain, like do we say, hey, don't be afraid to ask questions, or just because they're a doctor does not mean they know how to communicate things to you, because they can be very calloused. And I do want to point out, if you've got a doctor who's really in there and really empathetic, they can burn out. And then if you're really callous, then, you're not really feeling like so there's a sweet spot, in my opinion, for doctors where they have to be aware, but also not too much. Like, I remember one of these times where one of the 11 lumbar punctures that I got, and I was in the bed and I was kind of like leaned over so that they could get in between my vertebrae. And there was a doctor in front of me, and I think she was a new doctor. But she was so empathetic, and she was explaining everything that was happening as it was happening. And I remember, like, that kept me from spiraling down.
Right.
Like, I was upset about it, but I wasn't so, like, if I had been alone, I could have seen myself, breaking down. And I remember looking at her at that point, and I was like, please never forget exactly how you are right now. I said, because you've changed my life in this moment, and we need doctors like you. And she was really, really sweet, but I really meant it. So what happens when we don't have doctors like that? Like, and we don't have anybody advocating or a buddy system or anything like that. What can we tell people what to say, like how to stick up for themselves, so to speak, or to become less confused?
Yeah. Well, I guess how I used to practice in the past is that because I also didn't have the opportunity to sit in every single family conference, that the families that I took care of, in the past. And so what I often, try to do, at least in my capacity, is to, whenever I know there is an appointment, right? Could be reviewing, like certain scans, or whatever test results and so on. I often find that, I want to do the pre-appointment discussion and then the post-appointment processing. So in the pre-appointment preparation, I would brainstorm with them. I would ask them about, do you know what is this coming appointment's purpose of it? What are you scheduled for example? I will do the MRI, whatever. And then, and then I may ask, like, do you know what could be the purpose of that? Right. Or in terms of the results later on, what are some curiosities, what are some worries, that you may have. So we kind of like spend some time to have that kind of conversation, and then of course assuring them that, as patients, as family members, you do have, the responsibility and also the right, in a sense, even though we are not like pushing it, unreasonably, but just kind of reminding them that they have patients' right, that it is very understandable and very legitimate to ask questions, and sometimes I find that it's useful for them to just jot down all these questions that they may have, and they just need to bring it along with them, because sometimes in a conversation they may get carried away by some of the things that the doctor. So in a sense, then, they can refer to their own notes, to do that. And after the first 1-2 rounds, they may also learn, and so, they may then, also have the opportunity to kind of gradually build the trust, with their team, because as they ask, and as they get some answers, maybe addressing some of the worries, and so on. In a sense, this is a mutual relationship building process. And of course, I find that, if, especially when I cannot sit in with them, then having the post appointment debriefing, and processing can be very useful too, because I often then find that, there are still things that, that are lingering, there are still things that, they are trying to understand. And of course, then, if I'm not in the position to explain, right, or to clarify, then that's where, encouraging them to maybe, trying to catch, the nurse or maybe the doctor, the next time when you go back, or calling them, all this could be, like what you said earlier on, the sense of agency, right, is very important. And we can actually proactively, play a part too, and not just, passively, right, as if like being a victim, to this whole process.
Yeah, absolutely. You said a really important word in all that, and it was curiosity. Give yourself permission to be curious about what the heck is happening. And give yourself permission to ask questions about what you're curious about, and being able, like you said, to jot down those questions, because once you start getting answers and your brain starts spinning, those questions might go right out of your mind. I think another one is with a system that just does not have enough resources you have to advocate. I need to speak with a social worker. Somebody's going to explain something to me. Not being afraid to ask for what you need.
Yeah.
I know that it was interesting. I don't ascribe to any one religion. I feel like everybody is looking for the same thing, just with different languages, right? So I was surprised to find myself asking to talk with the chaplain. And I was like, you know what? They're non-denominational, which was important to me. And I'm having a lot of death anxiety right now, and I'm questioning a lot of things, and meaning and purpose, and the things that I was doing. I was getting, even when I left, I was getting chemo 3, 4, 5 days a week for quite a while. And I remember sitting down with her and having the access to the spiritual pain that I was experiencing.
That's so important.
And nobody came to me and said, hey, if you want to speak with the chaplain. I just happen to know that there are chaplains there, just because that's a something. So another thing I want everybody to hear is that, in these medical systems, spiritual care also can be available to you. And sometimes alternative care. Like we had Reiki practitioners. We had therapy dogs, and I asked for all of it. We had to ask for it. When he was telling me, I'm like, I want all the things. Like, I was so sick of watching The Big Bang Theory on TV. Just bring me a dog. I will be very happy. That would be great. But the curiosity part of it, being allowed. And I will say this, if it weren't the nurses were the backbone of my mental health during that process.
They play such an important, essential role.
Absolutely. I was being woken up every 4 hours for a month, and you get to know people. You actually get to know their work schedules. When are you coming back? I'll be back in 2 nights. Okay, I'll see you in 2 nights. But the amount of empathy that they carried. When I was in the shower, I was about week 3, and all my hair started falling out. And I was standing in the bathroom sobbing because I saw chunks and chunks of my hair on the floor. And the one nurse came in, and she just stood there, and she goes, what do you need from me right now? And I'm like, just stand here with me. The nurses and their patients, they're tired, and they're working really long hours, and they've got all these people. I can tell you right now, I don't think I would have gotten through that initial time, and even times after that, without the empathy of them. It's the fact that they were there, and not just there to they would come in, I'm sorry, I got to wake you up again, and what do you need? If I eat another peanut butter and jelly sandwich from the terrible cafeteria that they have here. I don't know what I'm going to what would you say to people and you talked about it with the TB, that are being subjected to physical types of procedures that they may not feel like they have a choice about whether or not they get or not, may not understand what it's about, and that it may cause physical and or emotional and psychological pain. What would you see in an individual who is dealing with that kind of trauma, and what might be helpful? Like that's a lot of questions all at once. I'm sorry. So
you are thinking about, what may be, what the medical professionals may want to consider for them.
No, the clients. Sorry, that's the thing. I went around in circles there.
Mm-hmm,
I'm sorry.
Mm-hmm.
No, that for the patient, his or her, themselves, when all of these things are happening to them, and they may not know why, and the pain that might come with it, the fear and the anxiety that you mentioned earlier, like that. I want people to know that that's just normal. And
well, it is a normal reaction to an abnormal situation.
Right? So what do you imagine could be helpful for people for dealing with that?
Well, I wish that there is a short answer to that, but again, each one of us is so different, right? And so I think maybe the starting point is knowing ourselves first. Knowing what could be my panic button, knowing my own threshold. For example, like maybe I am more sensitive to needle. The moment that I see it, or the moment that I know that I'm going to be poked later on, I start to, right? And so maybe starting from our self-understanding and knowledge, and also, of course, self-compassion, knowing that all this are not to indicate that I'm weaker than others, I'm more useless than others, little things like that. I also cannot take it, that kind of thing. But rather just to acknowledge that, yes, this is going to be difficult, right? And yes, I know that I may need more support, in certain areas. For example, asking ourselves, what am I afraid most, in this coming process, in this coming procedures, let's say, what is something that I want to know, or I think I need to know, right? Be it pain level, be it, the procedures detail in terms of the process, like how it happened, like how long it takes, that kind of thing, or what else, what is something that I don't want to know? I'd rather not hear in advance. Otherwise, knowing myself, I will, right, have all kinds of things. So different of us, cope differently. Some of us need to know in advance so that we feel like we have control. Some of us don't want to hear too much. I just, go through that and then that's it. At least it spares me, the preparatory anxiety, 2 weeks before.
Yeah.
People cope differently, and there's nothing wrong or right, or which one is better. After all, it's about what works for us. Yeah. Do I need company? Or I would rather, be on my own with strangers so that I don't feel like, I'm afraid of being embarrassing, like, and all these things, right? Or I need company. And then I want to make sure that, I want my husband to come with me. I want my, sister, to come with me, and advocate or appeal, for that, and see how much, we can negotiate all this before, the procedures to come, right? Sometimes we may ask ourselves if, do I need to bring along something? To let me hold, that may ground me, for example, or what is something that I would like to treat myself, after completing these procedures. What is a reward, that I would like to, just indulge myself, a little bit so that I have something to look forward to, for example, so we can have the kind of, internal dialogues, with ourselves, and of course, maybe with people who care for us, and especially if we do have a caregiver, our main caregiver, for example, could be our partner, spouse, right, or parent, right, or our adult children, who are our main carers. We may want to also have that kind of conversation, with them, right? Telling, our carer what I would appreciate, if I would cry, for example, or what I need you to do, when I started to, right, shake and all this, right, hold my hand, right, and so on, so that carers around, also know what to do, because oftentimes our family members, do care for us, do want to be there for us, but they are just clueless, they may be very helpless, and sometimes it's just, whatever that they can think of, they do it in that way, but may not, always work well for us. And so it may just create more frustrations, and more tension.
Yeah.
And so by giving them some tips, that can be very helpful. And I believe, those who care for us, love us, right, will be more than happy, to take all this, tips to just play their part, or maybe we can tell the medical staff, like the nurses, right, would you mind, doing this, for me, when I was, when I need to go through this. So all this could be important, conversations. I guess after all, fundamentally, it's all about communication. Yeah.
Oh, we're not taught that skill in school. We're taught trigonometry. I didn't use that one today. That's interesting. Gosh, there were some things that you had said that were popping into my head as you were saying that, and the first one there is, again, how to advocate for ourselves, how to tune in to know what we need and what we don't need. I imagine, though, there's also dynamics of that people have that are related to their own attachment systems of, am I allowed to ask for help? How do I feel about asking for help? Is that, if I struggle with asking for help, what is that thing that is that barrier that gets in the way of me being able to ask for what I want, right? And these are things that are, they're deep system individual, like our own systems questions. And then what do we do if our caregiver system, and that's a whole different podcast.
Yeah.
Or, our support system, so to speak, is either lacking, we don't have a whole lot of it, or it's actually not real supportive. That they're bringing you up to your appointments. This is not what happened to me, but they're bringing you up to their appointments, and they'd rather just not doing it, but they feel like they have to do it because who else is going to do it, and fine. Yeah, and I've seen some really bad situations. I've seen other ones where the caregivers were spectacular, but some people find meaning in being a caregiver, and other people feel like it's thrust upon them.
Yeah, it's a chore.
So right, and I'm not sure. I know that we're not going to solve that right now in regard to like telling people, well, this is what you do with your support system too. I mean, it's just a really big system to deal with as well. And then the medical system outside of the medical system. There's the in the hospital medical system. Then there's the outside, but still have to get treatment. There's dealing with the interpersonal part of it. And then another part of this, I'll say this briefly, and then another thing, because I have the memory of a gnat. One thing is the having to learn how to deal with the insurance system, which is a flippin' nightmare. And then there's the other part of identity. And I think if we could start with identity, because it's like, do you go from, and this comes from even a conversation you and I had before, like, can I say I'm a cancer survivor if I'm in remission, but still in treatment? And you called it the in-between. And I thought that was brilliant. And your writing about that was beautiful. But identity wise, the other day I came home, this popped into my head because that's what happens. Came home on Sunday from something I was doing, and our oldest was having like a little gathering of his friends. And Chase had said to the one of his friends who I didn't recognize, he was like, oh yeah, no, this is Chrissy. And he goes, oh, your stepmom. And he was like, yeah. And he goes, oh, the one who had cancer.
Ah.
And I looked at Jeff and in just kind of like what an interesting,
Mm-hmm.
like, I wasn't mad at him by any stretch of the imagination. I was just like, wow, like that has become part of an identity that just got reflected back to me.
Mm-hmm. Is part of our resume.
Right. It's part of our resume. So I guess that's where my question lies, is this identity that people often will take on, like as patient, as a person with cancer, as a person with this terminal illness, as a with whatever,
Mm-hmm.
somebody with TB, like that identity shifting not only within ourselves, but what's being reflected to us
Yeah.
by our significant others,
Yeah.
our society in general, the medical community. And then what do we do with that when our identities have been, how we understand who we are in the world is then being challenged? And I'm going, well, wait a minute, there's still me in here. And I don't want to be seen as the stepmom who had cancer.
Yeah. Yeah.
Does that make sense? Did I
Yeah,
talk
it
around
is.
too much there?
I mean, no, not at all. I mean, ironically, right, along the way in our, as we continue to live on, right, it's almost like we are collecting different badges, right?
Did I collect a cancer badge?
Some of the badges, we like it, we take pride of it. Some of the badges is like, I really wish to shake it off and take it off.
I don't need that one anymore, but there it is. I can't do anything with it.
So,
So how does it impact identity?
so this is really a humbling process to me. I always think that, this is really just reminding us that all of us are just human beings, right? I always say that, when it comes to illness and death and dying, that kind, all of us are on the level ground. No qualification, no seniority, would spare us, would give us any exemptions or any special privilege,
Right.
And so of course then, just like Viktor Frankl, that many of us, would be familiar with his work, is really about, if we cannot choose what kind of suffering, we need to face and go through, right, in life. The choice then lies on, the attitude, right, that we want to adopt. Of course, it's not easy, right? Something simple, we may be able to take it very easily, but when some trials, just keep on and on and on and on, right, it can be really testing. And so a lot of times it is really stemming from our internal relationship with ourselves first. Can I make peace with myself in the first place? Make peace with who I am at this point, and knowing that at another point, I may take on other roles, I may, it's kind of like playing a yo-yo kind of, right, a process, certain roles will subside. Like I used to be, maybe very proud of being a mom, right, when my child is young, but then when my child is old and you are retrenched, right?
Like, who am I now?
You're no longer needed, right? Then it's sort of like, so there will be times when certain roles become prominent, become our dominant, facade, in a sense, our dominant, identities. There are times that certain, roles and identities, and labels, right, will be subside, and that's part of life, that's part of our growing, and our developing. So being able to learn, this is what real lifelong learning is to learn, right, how to make peace with this, how to go with the flow, right? I know that you are very much into Buddhist practices and beliefs, right? I guess this is one of the key things, right? Not to be too attached, but not doesn't mean that we need to be so detached, right? Mm-hmm. Until like we are living in our own bubble. But like you said earlier on, what is the sweet spot here? And the sweet spot is not a static thing that once I get there, then I get stuck there. But rather, it's just like balance is always a process. is constantly moving, it's kind of, inclined to this or to that, but in a sense, you get a sense that it is not dysregulated, in that sense. So we are attached, but yet also detached, right? That kind of paradox is something that I think all of us just need to keep learning, and keep reminded.
I was also thinking, we carry many identities at the same time. And I think what I'm hearing you say is like sometimes they become bigger, like an identity might take up more bandwidth within ourselves, and then but ultimately, and tell me what you think about this, but there is a core self.
Of course.
That no matter what identity is in front of us or surrounding us, or we're projecting or is being reflected back to us, ultimately there is always the core self.
Yep.
And so
the character, right? The personal traits,
yes, exactly.
almost like the pillars, right? That build our kind of self, in that sense. So it doesn't matter what roles, right, or what identity that I need to play, right, at different points of time, but all those are stemming from the same congruent, right, consistent set of core values, or maybe character and so on, that that informed, and that also kind of like display, manifest, right, in all these roles, in that sense. So for example, I mean, as I shared about the TB experience, then is that after all, after when I kind of like subside, and air my fumes, that kind of thing, I just fall back to the core, because I recognize that what was insulted, is my sense of integrity as a person. And so then I told myself that, okay, if this is what I need to go through, then I go through it with my dignity, with my integrity, so I'm not betraying myself, at least, if not nothing else. And so then it sort of helped me reposition myself instead of going through it, still with grudges at times, but then at least it's it sort of like gives me the strength, and also the capacity, to go through it in a way that is more manageable for me.
You just said, how do I not betray myself to maintain my integrity? Wow. If you think about that statement, that can be used in so many of the things that we were talking about today.
Yeah.
Is not asking questions when you want to know answers a form of betraying what is a value of yours, which is knowing how to be taken care of? And if you have been betraying yourself in your life in general, to think about, is that something that maybe this could teach you? Maybe I could learn how to not betray myself, because I know we talk about meaning making a lot, right? Like you and I are both on that way of thinking about, going through things and shattering of the world that we understand. That meaning making and the benefit finding, so to speak, of like, what did I learn from this? That's a natural adaptive process that's going to happen if you allow yourself to get there. You don't have to. I mean, if you're learning things along the way and you're able to say, you know what, I'm really learning this about myself, that's fantastic. But sometimes a lot of that learning happens as the process continues, or if something does, end or whatever. But to remember that, the way you understand yourself in the world is changing. But that word that you said, am I betraying myself, and how do I maintain my self integrity? I think that is, I hope people hear that in this podcast. I really do.
In a sense, it's not a self-centered, orientation, but rather it is a humbling orientation, starting from ourselves first. If we don't know ourselves in the first place, how can we expect people to know us? right? If we cannot make peace with ourselves, then again, right, how can we then, expect people, right, to accept who we are, good and bad, and so on. So it all starting from here, right, like a little child, trying to understand, okay, what am I going through now? If I throw tantrum, what's the tantrum, all about? Right. What is something that maybe my little child inside me, is not being heard of, right? Or maybe my big ego inside, is really hurt, and so that's why I'm reacting,
Yeah.
and so on. And so just have that kind of, very innocent, curious, and open conversations with ourselves, as what you said earlier on, if let's say, asking ourselves like, okay, what kind of help, or how comfortable I am to seek help is maybe a little bit too much for us, like, because I'm not used to be in that kind of position. It's always me helping people, that kind of thing. Then maybe just change the words, by asking ourselves like, how do I want to be cared for? How would I want to be accompanied, in this process? Not to imply like receiving help or giving help is as if like one up, one down kind of position, but just as a fellow, sojourners, what kind of company do I need, right? And we can form, our own company, right? We can solicit, our own resources, just like nowadays many people, form their own family of choice, right? If family of origin, is really not working for us.
Yeah.
Right? And so similarly, we can form our own, company, to go through this process together.
I love that there is a sense of being able to develop your net. You do have, as much as you possibly can. And I think people that find themselves limited sometimes, like, oh, well, I don't have any friends, or I have
Right.
where are your resources and how can you find those resources? And, like, please know that you have the power to try to figure that out, or at least ask people who can help you figure it out.
Or, like pay attention to fellow, patients, right?
Yeah.
Or maybe asking nurses and doctors, would they have anyone recommended,
Mm-hmm.
that could buddy them, right?
Yeah.
In the process, yeah.
Yeah.
And so sometimes we just need to kind of remind, prompt, our medical team, to sort of like help them know how they can care for us better, and so it's a communication again, right? A
Yeah.
two-traffic.
Down to that communication. There it is again.
Yeah.
And I think that also happens with medical gaslighting, is that communication. Like, you're
Yeah.
telling me nothing is wrong, and I know something is wrong, and you're telling me it's not wrong, and I'm going to keep knocking on doors. Or you're telling me I've got this, and I'm telling you, no, I don't have those symptoms. And that, I mean, for women's biology is different than men's biology, and women, sometimes will be told, oh, that's just menopause, or, that's just this. And then you end up, I had one of my individuals who came onto my podcast, Samantha, she talked about how she had undiagnosed MS for like years and years. And she kept going to these doctors and she kept saying, no, I'm telling you, like, this is happening. This is happening. They would give her like, well, it's just this, and they would minimize it. But she was like a very assertive person. And so she would just keep knocking on doors. But the gaslighting that she was experiencing, but it came down to, trying to just not giving up the tenacity and to communicate. I mean, I really do think we're not taught to communicate in general. But people learning that communicative skill, finding, like you said, there might even be support groups, systems, professional systems that might provide the support. We might be surprised of the kinds of support. Like, I found out in the American Cancer Society has groups of people who will volunteer for you to stay at their homes. And like, let's say you live far away from a hospital and you have to go through treatment for like a week. They will like they volunteered for you to stay at that home, so you're
Wow.
closer to the hospital,
Mm-hmm.
and
Mm-hmm.
then the hospital or the Cancer Society will provide transportation from that person's house to the hospital and back. Look, you look surprised. That's right. Nobody, who the heck tells you that? Or there's, there's like camps that, not even camps, like a respite where people can, and I keep
Yeah.
coming to cancer just
Mm-hmm.
because this is what I've been learning, but where they'll see somebody who's been really overwhelmed, and
Right.
the staff, and they can go,
Right.
oh, I can put a recommendation in for you to
Yep.
be able to go away to the
Yep.
Poconos for a week, and
Mm-hmm.
they
Mm-hmm.
pay for everything, just
Mm-hmm.
so you and your family can get away a little bit. But it's not
Wow.
like anybody's telling us this stuff, right? You got to
Right.
communicate, and you have to ask and look online. Like you said, the
Yeah.
society.
Nowadays, yeah,
Yeah,
online resources. Yeah.
yeah, good
Yeah.
resources too. Don't go on Reddit and think you're going to get everything. Like if you get an
Yeah.
idea there, yeah, sure. But I
Yeah.
mean, if there's
Yeah.
something that you
Yeah.
have,
Some trustworthy,
right,
sources, and
sources,
official, right,
sure.
entities and all this. Yeah.
Yeah.
Yeah. Yeah.
Do you think there's anything else that people with medical trauma, to leave them with a sense of hope, so that they know that they can rise from this trauma and not be re-traumatized along the way? What can we share or pass along to people who are medically traumatized that can help them heal?
Well, I certainly would want to encourage them to reach out, and seek support, maybe in the form of trauma therapy, because one thing that is unique in medical trauma as compared with other kinds of trauma, or most, I won't say all others, is that because the medical trauma stems from an illness, right? Stems from, a particular, maybe, a treatment, and so on. And so there is more likelihood that we may need to continue to live through this medical trauma because our illness require us to continue to go for reviews, right? Our treatments may last for a period of time. So it is kind of like different from some other typical traumas, that people generally recognize. That is more like a one-off incident.
Mm-hmm.
And let's say earthquake. Okay, if it's done, it's done, right? Over. Even though after a while there could be aftershocks, but after all, it's done, right? But medical trauma sometimes is not. It's almost like domestic violence in a sense that it can be ongoing, for who knows how long, and so that's where all the more we need to really take care of ourselves by, giving ourselves the support, the therapy, the healing opportunity that we do deserve to get, and so by seeking professional help to help us process this, to address, the trauma, to help us, in a sense, enlarge our threshold, our window of tolerance, so that we don't keep accumulating, right? And all this is just going to, in a sense, not doing ourselves a justice afterward.
Yeah.
Yeah. So that is important. Of course, if we think that, okay, maybe I'll try to cope on my own first, but if after some time things still don't seem to be right, moving on a good directions, then maybe, yeah, we do need to revisit this idea, and source for, appropriate therapeutic, support to help us with that.
Yeah. I think also remembering that you have strengths. What are your strengths, and how can you build upon them? And
Mm-hmm.
what do you have outside of this, identity of the patient or the trauma itself, that can be part of your life?
Mm-hmm.
Do you like music? Do you like getting outside? And are you allowed to garden? If you're allowed to garden, you
Mm-hmm.
can go out and
Mm-hmm.
garden. Do you like, music, or, painting, or you want, like, what else can you get involved in so you don't narrow your world down so much? Because
Right.
I think with trauma, narrowing our focus is very normal. that's what we do when we fight, flight, freeze, or fawn, right? We narrow down because it keeps
Yeah.
us
Yeah.
focused on
And
what the
get stuck
danger
there,
is.
right? The window doesn't learn to reopen.
Exactly. So what can you do to kind of open up your world again, and what can you do also to take care of your body in a loving way? Because if there's something that is ill in your body or that you've been fighting, you may not feel that your body is safe. So what can you do I don't care if it's like putting lotion on your body every evening, or it's stretching, or it is talking to your body, whatever you need to do. So just to
It could be a
be
healing ritual.
wide.
You know?
Yeah. How can you be nurturing to yourself to help mitigate the impact of the trauma? Because the trauma's there, and there's always grief and trauma, but there's not always trauma and grief, right? So what can we do in order to kind of open ourselves up in a safe way to dose it? You guys talk about dosing a lot. How do you dose yourself to processing, whatever that means for you, what you're going through, but then to go, okay, I need to put a pause on that right now. And then, I love cooking. So I'm going to go do something, and I'm going to go bake Christina a pound cake, because we all know how much Christina loves pound cakes and brownies. Whatever. So I get that was another thing that I was thinking about is people can take care of themselves at a time where they're not feeling well, even if it is drinking water and watching your favorite show.
Yeah, most of us do have our resilience, and tenacity, as you say. So not to forget that. And it sort of like reminds me that one exercise that I sometimes may suggest to clients that I work with is what I call my logbook, in this illness journey. So it's just a simple exercise, as you mentioned about, meaning making and benefit finding and all this. It's basically just if you have a piece of paper, you just fold it in a way that is kind of like a pamphlet kind of thing, so free fold, kind of thing, and then one part in this, let's say, of the free sections, right? In the middle part, I would usually like to encourage them to think about, what are some difficult times, right, or losses, or trials, that you have gone through during this period of time, and so they list, they claim, whatever, as many as they need to, in words, in colors or whatsoever. And then after then, they may fold, one side of it, right? And then on this side, of the pamphlet, they may then, ask themselves, despite the losses, right, or the painful times, agonies, that they go through, are there also, some silver linings? Are there also some learning lessons, or something that I come to appreciate, or I was thankful for, because things could be worse. Sometimes downward, comparison may help, in some sense. So again, they can list as many as they want to, on the other side of it. And then finally, as they, sort of like fold, the last part, right, the cover in a sense, then they may want to ask themselves, like, what is now important to me? What, having gone through so much, what is something that I want to treasure, I want to safeguard, and so on. Or maybe I want to learn and grow, and so I call it as a logbook, LOG, because it's about losses, right, agonies and so on. And then the oasis, in terms of like some benefit findings, to comfort us, not to negate, or replace, right, the losses, as they are still there. But in a sense, symbolically, as we fold the other side over, with some, appreciation, with some, thanksgiving, it kind of like a balm, to soothe, right, the pain that we have to go through, in that sense. But yet then the last part, about the growth, about the goal, that I need to focus on, as that is also the cover, right? containing all the pains and the gains in the process, may also then help us to reset our focus. Maybe not to think too far, but just focus on here and now, this current phase. What is something that I can do? How can I spend my time even in terminal illness, right? How can I still live my days, constructively, right? Or what is something that I cherish that I would like to really, right, make good use of my breath, my health, and so on. Yeah. So that is something that some people find it useful, and along the way, their logbooks becomes like a series in a sense, and kind of like sometimes we just need to dig it up, to kind of remind ourselves what we have gone through, and all this are part and parcel of our life history. And life journey, in a sense, to make us who we are now, who we have become, or maybe who we are not today.
I think that's really important. Who are we? Who are we becoming? And who are we no longer? I love that. What a really cool idea. I really, that's really cool. Something people can do. So I think we're leaving people with some things to do. Actually, they can physically do some more insight. I hope they don't feel gaslit any longer. We're here to not gaslight you, and to make sure that you are able to think about what you need and to figure out how you're going to advocate for that and the resources for it. Well, again, I want to thank you, Carolyn, for being here. I mean, this has been really important. I've received a lot of requests for this topic, and again, I want to remind everybody about the Portland Institute for Loss and Transition, which I have a lot of fondness and respect for. I have learned so much through that entire organization, and just want to thank you for taking this time. I know you're really busy, so I finally nailed you down.
Well, we all are busy, just busy with different things.
This is true. But thank you
thank
so
you
much.
for the privilege to be in this space with you. I hope that this is an important topic for sure. And I hope that our sharing, our discussions, our ideas, would really be useful, for some of.
Well, thank you everybody for watching or for listening. And if you are watching or you're seeing anything that has like little places where you can write, if you have any questions for myself or for Carolyn, any feedback about what you thought about the episode, please go ahead and write it down in the section below. And if you are curious, you can find the Portland Institute website at www.Portland Institute for Loss and Transition.
Just Portland Institute.
portlandinstitute.org, right? portlandinstitute.org to learn a little bit more. And I want to thank you again for listening, and just to remind you that sometimes it takes challenge to find the courage to heal. And I look forward to our next episode. All right, take care.
Thanks for listening to Phoenix Rising with Dr. Z. If this episode helped, subscribe and share it with someone who needs it. We'll see you next time.